In this lecture, we are going to study the process of hemostasis. So what is hemostasis? Well, we break the word down. It's a combination of hemo, which means blood, and stasis, which means stop. So what it actually means is the cessation of bleeding. So when we have damage to a blood vessel, we are going to bleed. We're going to have a cut inside that vessel, and so blood will leave the vessel, which is going to be some sort of trauma. And obviously we don't want to bleed to death. And so hemostasis is a process that's going to occur of specific steps. The steps always occur in this exact order. And the process is going to be to decrease blood loss and eventually stop the loss of blood from the vessel. And so the steps are going to happen in this sequence. The first step is called the vascular phase, and you can see it's going to involve the blood vessel only. And then we will go into the blood with the platelet phase, where we're going to form something called a platelet plug, which is a temporary blood clot. And then we go into the coagulation phase, where we're actually going to form a more permanent blood clot to plug up and seal the vessel to stop the blood loss from the vessel. Once that happens, we'll start to heal the vessel as the vessel starts to heal, the tissue heals, and then that clot will need to disappear. So we'll retract the tissue will heal, and then eventually we need to get rid of that entire clot because it's not normal to have a blood clot in the area. So when we're looking at hemostasis, the first thing we have to look at real quick is just a typical blood vessel and look at the anatomy of a blood vessel. Now, a blood vessel is going to have this inner lining. This inner lining is called the endothelium. And if you look close, you might recognize that epithelial tissue, simple squamous cells. And this single layer of cells is usually called the endothelium. It's the lining of the blood vessel. Below it is the connective tissue called the basement membrane. And then there's a little bit of smooth muscle often in what's called an arteriole or a blood vessel. Now these epithelial cells or endothelial cells, they're right next to each other. So anytime you have any kind of injury, notice these cells are going to be torn. They're going to be damaged as well as the tissue below it. So when we have trauma to a vessel, we have the very first phase, which is called the vascular phase. It's the immediate response. So what causes it is trauma, which damages the endothelial cells. And when these cells are damaged, they're going to release chemicals. Now, there's a lot of chemicals released. I would like you to know chemicals called endothelins are released from the endothelial cells, and serotonin. You've learned serotonin before. It also comes from these cells. Also, some pain receptors release chemicals. So when the damage occurs, chemicals are released. These chemicals cause a spasm. The myogenic, myo means muscle. So it causes that muscle layer to spasm. And when that muscle spasm, that means it's going to contract. So you're going to have a vascular spasm. And the vascular spasm is going to be called vasoconstriction. So that blood vessel is going to immediately constrict. And so what happens is it's going to narrow. And when it narrows, that's going to decrease the blood flow to the area and decrease the blood loss. It's not going to stop the blood loss, right? We still have the hole here, but its job is to decrease blood loss. So our immediate response happens at the vascular level. It's an immediate vasoconstriction. Now, within seconds, we're going to go into the platelet phase. Now, the platelet phase is going to occur to form this plug. So we have a hole in the vessel, we need to plug it up. Now, the platelet phase, normally your platelets just flow through. They are not sticky, they flow by in the blood. But when you have this damage, these endothelial cells that are damaged release chemicals. They also release a very important one. We usually just abbreviate it VWF, and it's von Willebrand factor. So we just say VWF. This is a very important factor. When you hear factor, that means protein. It actually is going to be released. These little blue dots here represent it, and it's going to bind to the platelets. So that's the first step here. When it binds to the platelets, it's going to activate them. So the platelet phase is going to be caused by the von Willebrand factor. It's going to bind to the platelets and it's going to activate them. So what happens is it binds to platelets and activates them. When we say platelets are activated, activated, what that means is now platelets are going to start to release more chemicals. And when they release chemicals, that's going to basically cause what's called platelet aggregation, which means clumping. So they go into a positive feedback loop. So we get this activation, we get more chemicals are going to be released. And you can see some of the chemicals that are released, ADP, ATP, even more serotonin. So serotonin helps with the spasm and also with the activation of the platelets, thromboxane, A2, and calcium. And so we get positive feedback where the platelets stick and they clump and they release chemicals, and they make them sticky and they clump and they release chemicals, and they get activated and they get aggravated, they stick together. And the purpose is to form this platelet plug. And so what we've got is this platelet plug. It's a temporary plug. And now it's going to close up that small break. And its job is to form a temporary blood clot to decrease blood loss. Now, this is a temporary blood clot. It's unstable. It can be broken apart. It can be pulled away. We need to make this a permanent clot. So that's why we're going to go into our coagulation phase. Now we need to secure that clot with this stuff called fibrin. And in order to go into our coagulation phase, we're going to have to use clotting factors. So clotting factors are clotting proteins. They're often called a procoagulant because a procoagulant is something that helps with this whole process of hemostasis. They are all made in the liver, and they are all Roman numerals. I know how much you loved Roman numerals when you learned cranial nerves, but I didn't name these. Sometimes we just use their name. Like we'll talk about fibrinogen. We won't call it factor 1. We'll talk about prothrombin. We usually just say tissue factor and calcium ions. We don't call them factor 4. We're not memorizing every one of them, but notice there's 13. And they're pretty important and critical. If you're missing any of these, you're going to have problems with this coagulation, with this last step where we're forming that stable, permanent blood clot. And they also require, the liver needs vitamin K to make most of them. So it's important that you have enough vitamin K. You don't have to memorize which. We're just going to generically say you need vitamin K. Now, a lot of them are made in an inactive form, and they need to be activated. So the way that they're shown if they're activated is, notice all the Roman numerals. Whenever you see the letter A, they kept that part simple. A means activated. So when factor 12 becomes factor 12A, it became activated. Now it's in the active state and it's doing something. Excuse me. And it's kind of like a domino effect. As they get activated, one triggers the next, which triggers the next, which triggers the next. Now, it would be wonderful if they went in order, like, 1, 2, 3, 4. They were named in the order of discovery and not in the order that they jump in. We're not memorizing every step, so don't worry. There's a few that I want you to learn, but you can just kind of see what we're going to have is what's called an extrinsic pathway and an intrinsic pathway. So coagulation forms the permanent blood clot to stop blood loss. It's caused by the clotting factors. And what happens is two pathways. One's called intrinsic, which is better called contact activation because it happens inside the bloodstream from the actual collagen fibers inside. The other one is called the extrinsic because it happens from the outside, from actual damage to the blood vessel itself. So the intrinsic happens inside the blood. When the inside of that vessel is damaged, the inside has collagen. And those collagen fibers that are damaged, as the blood goes by, the blood comes in contact with that damaged collagen, and that's what starts this whole process. I would like you to know that the intrinsic starts with factor 12. So we're going to memorize 12 for intrinsic. We're not going to memorize all the other ones, but notice there's several that are involved, and that it ultimately requires factor 12 and requires calcium. And then it goes through a bunch of steps to get to factor 10. Don't call it X, it's factor 10. That's the goal of this. Now, anytime your blood comes in contact with collagen, which has a negative charge, it starts this pathway and gets you to factor 10. So this is why sometimes when you are giving blood, you're having blood work done, they have to use like heparinized or special tubes, because when you give the blood, if that blood hits glass and it has a negative charge, it'll actually coagulate inside the glass tube, which if you're donating blood or you're trying to do lab work, you don't want your blood to clot. Notice the intrinsic has a whole bunch of steps here. Look at the extrinsic. The extrinsic starts from damage in the actual blood vessel, and it starts with what's called tissue factor. So I'm fine with tissue factor, or you can call it factor 3. It doesn't matter to me. But notice we just have one, and then it's just like one, boop, there, we're there. Extrinsic is faster than intrinsic. They both get you to the same spot. Their job is to get us to this in black here, which is called the common pathway. So when we look at coagulation, it's caused by clotting factors that are made in the liver. Once they're activated, we either go through intrinsic and extrinsic, and they usually both happen, by the way. Their job is to get us to the common pathway. And then once we get to the common pathway, this is the gist of it. This is what we're trying to get to, because this is where we're going to actually form our permanent clot. And the common pathway, we have to get to factor 10. So when we get to our common pathway, you have to know these steps. So 10 becomes activated 10A. Little a means it's activated. Once we get 10A, that will form something called prothrombin activator, or you can call it prothrombinase. Depends on what book you look at, what website you look at. These are the exact same thing. Does not matter to me. In this picture, I thought it was a nice simple picture. You can see the intrinsic pathway as well as the extrinsic. Tissue factor starts the extrinsic. Notice they both require calcium. They both get us to the common. The common starts with factor 10. It becomes activated. And then that gives me either prothrombinase or prothrombin activator. Pick one, okay? Make sure you know one or the other. Some old quizzes, honestly, I don't remember which one I used. I'll try to put them, I won't make you pick one or the other on the test. It might be easier to remember prothrombinase. I really don't remember which one is in your book. I'll try to use prothrombinase. How about that? Because I think that's easier, because you see the ACE and you'll remember it's an enzyme. So now that is an enzyme that catalyzes the reaction of prothrombin. Pro usually means it's inactive into thrombin. So now we take the inactive form and we activate it to thrombin, which is another enzyme. They just didn't add the ACE to it. Now I have thrombin that catalyzes the reaction of fibrinogen, which is a protein in your plasma, into fibrin. So when I get my fibrin mesh, this fibrin protein is what's going to kind of lay down in here like my scaffolding and actually form my permanent clot. And then that is going to form my permanent seal and close that up. There's a couple short animations here. I'm going to show you one. They're both going to be in helpful links, but it might be good for you to see this process.
We often experience pain and swelling when we have an injury, right? But have you We often experience pain and swelling when we have an injury, right? But have you wondered what is going on inside your body? Let's find out. Blood moves through our bodies using arteries, veins, and capillaries, also known as blood vessels. When we have a bleed, blood vessels are damaged and our body tries to fix itself. Sticky pieces of cells called platelets gather to patch the injury, but that is not enough. So a multi-step process called the clotting cascade begins. The clotting cascade has 3 different pathways: the extrinsic, the intrinsic, and common pathways. This all may sound very scientific, but understanding a bit about them can help you know what happens when you have a bleed. An injury, some type of bleed, causes the tissue factor, factor 3, located on the outside of the blood vessel, to bond with factor 7, which is one of the factors circulating in our blood. This bond activates factor 10, which means that factor 10 changes into a form that allows it to work to stop a bleed as part of the clotting cascade. The activation of factor 10 starts the common pathway. When there is an injury, factors found inside the blood vessel are activated. The activation of factor 12 starts the intrinsic pathway. Factor 11 activates factor 9. Von Willebrand factor stabilizes factor 8 as it moves toward factor 9. Factors 8 and 9 bond together, and this bond activates factor 10. This is the start of the common pathway, and clotting continues with factor 10 combining with factor 5. This allows for the change of prothrombin factor 2 to thrombin factor 2A. Thrombin then changes fibrinogen factor 1 to fibrin factor 1A. Fibrin combines with factor 13, which makes the platelet plug stronger so that the blood clot is secure. A lot goes on behind the scenes of the clotting cascade. If you have a bleeding disorder, that means that something is off with one of the many factors that help the blood clot.
So a procoagulant is anything that helps this process occur, whether it's the vascular spasm, the platelet plug, the coagulation. So take a second and just think about some procoagulants that you've learned and see if you can jot them down on your paper. And then I want you to know that anticoagulants are things that inhibit the clotting process. And I know you've heard of heparin before. There's something called protein C. This is an anticoagulant. You can see right here. It's in your plasma, and it actually directly blocks some of your clotting factors, so it inhibits clotting. You can see heparin. It actually does something, it forms something called antithrombin. So heparin and antithrombin both block thrombin. Remember, we go up here. Thrombin was critical for forming this fibrin mesh and forming that clot. So if you don't have that, you can't form that clot. We have something called prostacyclin, which is pretty important. It prevents your platelets from clumping, and it keeps you vasodilated. So this is an anticoagulant, keeps your vessels open and doesn't allow the platelets to clump. And aspirin also works like prostacyclin. It inhibits platelets. It doesn't allow your platelets to become sticky. So normally your anticoagulants are dominant because you don't want your platelets to become sticky unless you have an active bleed. Because if they become sticky, that's a problem. Then you're making clots when you shouldn't. And we'll talk about that later. So let's think about some common issues that could occur with clotting time. Now, you saw in the one image up here where it talked about different ways of measuring clotting time. I'm not getting into that level, but you can measure, there's something called a prothrombin time and a partial time, and there's an INR, and I'm not getting into all the labs, but just know that there's different ways that you can measure the effectiveness of an extrinsic pathway, extrinsic and common, and intrinsic, and you can do a bleeding time to assess your platelet. There are different tests you can do to assess those if your patients are on different medications. I want you to pause and I want you to think for a minute, because the only way you're going to learn this is if you do the work on your brain. You don't want to go to the gym and stand there and watch someone else lift weights and expect to get stronger. So I need you to do the work and think about what would happen to clotting time in these situations. So hit pause and think about it, and you're going to have some questions to answer next. So hopefully you were able to follow with that. Let's go over some of these situations. So hemophilia, you've probably heard of before. These are X-linked. These are inherited on the X chromosome. Remember that if you are genetically a female, you have 2 X chromosomes, whereas males are going to have an X and a Y. So the hemophilia is X-linked. Female are going to have, we'll use H's, would have 2 of these, whereas male would have 1. So biological males have an XY. So if you have one of these X's with the hemophilia gene, you're going to have the disease, remember? Like color blindness, you might remember that from Bio 119. So you're going to lack clotting factors. It varies which clotting factor you're missing, determines the extent of it. You know, if you come up here, if you're missing something maybe in the intrinsic pathway, it won't be so bad because the extrinsic can take over. If you have a problem with factor 10, that's a big problem, right? Because then you can't start the common pathway. So it just depends on which one. You'll have slower bleeding times to occur. Liver is critical. If you have issues with your liver, you can't make all those procoagulants. Remember, this whole chart Most of these are all made in the liver, so you're going to have a prolonged bleeding time. It's going to make it very difficult. The liver also needs the vitamin K, which came into one of your other questions here. But if you have a patient with hepatitis or cirrhosis, they're probably going to have problems with bleeding. They're going to be probably easy bruising because they're going to bleed more often. And that brings us to our vitamin K deficiency. So if you don't have vitamin K, you're not going to be able to make all of those clotting factors. And so you're going to have trouble and you're going to bleed too much. Now, the protein C, remember, protein C is an anticoagulant. So if someone has a protein C deficiency, these are all proteins. These are all encoded by your DNA. This is genetic. So it's inherited. Now, if you don't have the anticoagulant, you're not inhibiting your clots. You're more likely to make abnormal clots. So now you have a higher risk of having a stroke or a heart attack, and you're probably put on some sort of blood thinner as a preventative medicine. People who have issues with bleeding, where they bleed too much, maybe they have clotting disorders where they're hemophiliacs, or they have liver diseases, what happens is you're going to see that they're going to have more bleeding. They're going, you might have bleeding gums. Petechia, it looks like little red dots, or like spontaneous bleeds in blood vessels that can occur. If you're more prone to these bleeds or GI bleeds, we know that our NSAIDs can make this a little worse, and I'll talk about that in the clinical piece. But you're going to have, prolonged bleeding times, more bruising can also occur. So let's say that you formed your clot, you have your fibrin clot. So what's going to happen now is the tissue needs to heal. That blood vessel needs to heal, and it will, because these cells will undergo mitosis and it will fill in. And so what will happen is you'll start to retract the clot. So that clot will kind of squeeze the edges together so that the fibroblasts can come in and secrete collagen, and it can lay down new matrix and heal. The smooth muscle will heal, and eventually that tissue will heal. Once the tissue heals, now you're going to have to get rid of that blood clot because it's taking up space, right? It's narrowing the inside of the vessel, so we need to get rid of it, and that's called thrombolysis. See the word lysis? So now those endothelial cells are going to release something called TPA. TPA stands for tissue plasminogen activator because it activates this thing called plasminogen into plasmin. So plasminogen is the inactive form of plasmin. And plasmin is another enzyme. They named a bunch of enzymes without the ACE, so we have to get used to it. And plasmin's job is to attack that clot and break it down. So sometimes we call it a clot buster. So it breaks down that fibrin and it dissolves the clot so that it goes away. And that's critical because we have to be able to get rid of the clot when we're finished so that the area is free of the clot and the blood flow can be restored. So this wraps up our lecture on hemostasis.